people with diabetes actually get several potential advantages. Of course, the best way to learn is to ask them. But when I do ask them, what they reply to me is that there are several levels. The number one probably is security. Continuous glucose monitoring gives them more security and gives them more knowledge. And even with the alarms that are predictive, they can prevent things that they don't want to see. Of course, if this is linked to a continuous subcutaneous insulin infusion, then they can react very quickly. Some hate tubing and have tubeless devices. Some are bigger, some are smaller. But basically, it's the easiness and promptness of reaction that usually leads them to use this technology. And then finally, if the two are connected by an algorithm, then of course, it's what we call now advanced hybrid closed loop. And there are also several versions now out, and they uniformly work, which is really nice. I mean, they work as a commercial product, and also in this group, do it yourself or whatever, you name them, several engineers designed their own very sophisticated devices that really work with a time in range above 80%. So quite impressive and robustly safe, as several data reports actually show. I have several dreams for many years, and I'm a bit lucky because some of them become true. My first dream is that people with diabetes can accept this technology and use it efficiently, because this is the most important part. So I believe we really have to include people with diabetes and basically give them a podium to say what is acceptable, what helps, and what finally doesn't. And the dream, of course, is an implantable sensor that would work perfectly for many years, so that perhaps I implant a sensor to a person with diabetes for 10 years. And perhaps this sensor measures not only glucose, but several other parameters, like perhaps ketones. So this is just another dream. And then, perhaps to have a insulin that's so fast that you can almost mimic the physiological need. And perhaps you don't have to, cover your meals in advance anymore. And then more artificial intelligence by following habits of people with diabetes, which would again help predicting what's next and more precisely decide on the dosing. And finally, I dream about devices that will ease the life of people with diabetes. So that will be really a reduction in burden, not an increase in burden with all this technology. Finally, I dream about cure. Despite the fact we discuss technology as a help, as a better management tool a lot, there are ongoing trials. There is the big European INODIA, publicly and privately funded initiative. Within it, there are 4 intervention trials currently. So obviously, with all this technology that will help millions of people with diabetes, I still hope for a cure and try to be actively involved in the search for it. In people with type 1 diabetes, CGM is the standard of care, both by the European and American standards. And there is no question, it's used by more than a half of people in every country in the European Union and the United States with type 1 diabetes. So I think there is little discussion here. And all this artificial intelligence help either through apps or continuous subcutaneous insulin infusion, or now connected pens will actually be obviously the standard of care. Saying this, I believe that for individuals with type 2 diabetes, this will become a standard of care, particularly if it will be linked to an artificial intelligence a decision support system, because many people with type 2 diabetes are seen by general practitioners. And because of the time constraints and amount of these people that need help, artificial intelligence advisors or decision support systems will considerably facilitate the use of CGM-derived data, and of course, additionally help general practitioners to really manage individuals with type 2 diabetes well. It's always a question. So CSII insulin pumps are here for more than 30 years altogether. It's recently that they really became very precise and with very small amounts of insulin. And some of them are pretty, and some of them are smaller, some of them are tubeless. So I believe there will be, a further development, particularly in disposable patch pumps or things like this. But I think what the real development is that there will be more intelligent, so that the artificial intelligence inside them or inside the mobile phone that runs them or whatever will basically make them more intelligent and will reduce the burden of commanding the pump. So the artificial intelligence will hopefully take more and more burden from the individual with diabetes to the automated artificial intelligence systems. I think the hurdle that hurts me most is my colleagues, diabetologists. There are still people that lack sufficient training and interest in using technology to help people with diabetes. So this is something that is very close to my heart, because I'm a little bit embarrassed that some people that treat individuals with diabetes are still, in a way, reserved or reluctant to use technology, despite the huge amount of evidence from randomized controlled trials and real life reports, registries. Yesterday in JAMA, in Journal of the American Medical Association, the big insurance system from California, Kaiser Permanente, really unequivocally proved the advantage of CGM both in type 1 and type 2 diabetes. So this is my first concern. And then probably the second concern is in the European Union, the public insurance system. There are very clever public insurance systems like the one in Belgium. They did a prospective trial, they financed it, and they learned they can save money within the same year. So the decision was very easy. And then you have some more stubborn insurance systems. I don't want to name them, but probably every listener to this will realize. And this is a shame, because the systems are spending more money with not reimbursing CGM and directly harming people. So I do hope that this will change based on the evidence, and basically that the availability of these devices covered by the national insurance systems will become universal in the European Union.